Thank you everyone for coming to another Apollo webinar. It's so good to have you all and to be together, even though unfortunately, given the current situation, many of us are very far apart. And we really appreciate you taking the time to spend with us on this Wednesday afternoon. And we are very excited to have with us a good friend and close colleague who has been one of the earliest beta testers of the Apollo technology from the early prototype days all the way through today, where we're conducting clinical trials together. And that person is Amy Edgar, who is a nurse practitioner and runs the Children's Integrated Center for Success in Allentown, Pennsylvania, which is an in-person and digital mental health clinic for kids and adolescents. And correct me if there's anything I get wrong here, Amy.
Nope, you got it.
But they take a really innovative approach. And part of why we're so excited to have Amy here today is because a lot of people, when it comes to the challenges that we're facing prior to COVID with our children at home and going to school with the new schedules in school, they're very demanding, and the just having to be in a chair all day, not getting enough movement and exercise. And a lot of parents are confused and finding themselves really having a hard time. And this is incredibly challenging for them. I tend to see the parents and hear what they have to say, when Amy on her end ends up working with the kids and the families, the parents as well. And they take such an interesting approach because unfortunately in Western medicine, the pattern to this point has been, let's just prescribe medicine for this. Right. And there has to be a pill that will fix this problem. And oftentimes that's actually the thought process behind the person who's seeking help, because that's what they've been taught. However, we know from an incredible amount of scientific literature that there are so many more sustainable, more effective, and with long-lasting benefits ways and methods that we can tackle some of the challenges that we face and that our kids face at home growing up in a regular day-to-day life, but also compounded now by all the changes that have come about as a result of the COVID-19 pandemic. So I think just to start out, Amy's clinic is so exciting because they really focus on minimally and non-invasive techniques. And that's why we've really come together on this vision that we can provide better care for kids with less side effects and a higher quality that teaches them how to heal themselves and how to stay healthy and want that for themselves. So Amy, I'll turn it over to you if you want to just tell us maybe a little more about your clinic and sort of and about yourself, maybe a little bit about your background and your training, what got you into this. And also, tell us a little bit about CICS and sort of the innovative programming, because telehealth right now for kids is actually good quality telehealth for kids for mental health is quite rare. But you guys at CICS do an incredible job, and I think are really setting the standard for a lot of other clinics out there. So, thank you again for joining us. And
yeah, absolutely, it's great to be here. I was humbled to be invited, and I was a little sad when you said that high quality pediatric behavioral health or mental health care is hard to find. So that's a problem that we're thinking about deeply right now and looking for ways to solve. I am a nurse practitioner. I have 2 credentials as a nurse practitioner, one in primary care and one in behavioral health. And I trained early on as a therapist. So my very first experience in healthcare as a provider was as a nurse, and then as an advanced practice nurse as a therapist. Somewhere along the way, I realized that I needed to be able to take care of the whole person, the whole child. And so that's when I went back to school and did a postmaster's in primary care. So I wanted to be able to check you out for a strep throat and also talk about your anxiety. And sometimes those 2 things are related. And so having that dual credential allowed me to be able to do that. I live in Allentown, Pennsylvania, and I have 2 children, 2 daughters. One is 23 and one is 20. My 20-year-old daughter has autism. She has the kind of mild version, meaning that her language skills, language processing are a little bit impaired. She's also really smart, really bright, and we've worked hard across her life to give her opportunities to achieve success. And so that's a nice segue into Children's Integrated Center for Success, or CICS. Really is about helping kids and families find success. And so I always joke and say that CICS was my midlife crisis. And maybe that's true. I had a moment in time where I asked myself, like, if all I do professionally is what I've done to date, am I going to be satisfied? And at that point, I'd done a lot of really cool clinical work, and I was a professor, and I loved working with students. And so it wasn't that I didn't love my work. It's the question was, do I have anything else I need to do? And the answer was yes. And that thing is CICS. So, I started thinking about it, seriously in 2013, and took the leap, bootstrapped the practice. I don't have a partner or a funding source outside of, the money that comes in through commercial insurance. And we started in 2014 with patient number one, with my very first kid walking in the door. I can still remember her face and her name. She had long, long blonde curly hair. And we're at 5,900 and something today in terms of kids that we've worked with. So I always say I'm the luckiest person alive, because I got to create what I wanted to do. So I didn't have anyone telling me things that I couldn't do. So I think that's a really important point to make about the practice. I am very, very conservative when it comes to evidence and recommendations for kids and families. If we're going to recommend something, I am really, really clear that it's going to work, or that it has good science behind it and evidence to support the use. Not to say that we won't try new things, because that's how we met. Looking for something non-invasive, looking for something for kids that would help with their anxiety that wasn't a pill. And so our practice begins with really a conversation and hearing from families, what are their goals? What do they want help with, or what do they think they need? Also really trying to understand the kids. So we do a very intensive diagnostic front end. It's really more about understanding a child than diagnosing an illness. And we're using all kinds of evaluation tools that are gold standard in the discipline. So we do an occupational therapy evaluation looking at motor and cognitive function. We do a speech and language evaluation looking at expressive receptive language and articulation and social language. And then we do more cognitive testing, looking at memory, working memory, and processing speed. And then we do traditional evaluations, like what you would get if you went to see a child and adolescent psychiatrist, or another mental health provider. And so we also do genetic testing, looking at genes that really predict response to a variety of things. So not just medication, but also supplements. And that testing also gives me information about things like exercise and the benefit of exercise for a kid cognitively. And so when we're done, we take all that data, and it's about 6,000 discrete points of data around the child, and put it all together, and then look for the patterns, the information that reinforces from each of those discipline-based evaluations. Yes, this is something we need to focus on. And so we very quickly get to high value targets. So I'm not diagnosing things. I'm looking at strengths and weaknesses, and how can this
not applying labels for the kids.
Correct. Yeah.
We're really figuring out, like, what's at the root of this, and that's causing what we see as these symptoms, and how do we get to the bottom of it.
Yeah, exactly. And so we can use clinical language, like I can generate a medical diagnosis. Um, and often we have to because of, people using commercial insurance. That's really the biggest driver of that. For us, it's more about understanding the child, and that doesn't come with a label. It comes with, an understanding of you. And the children are included in these conversations when we report out on what we found. So we teach the moms and dads about their child, and then we teach the child about themselves. And then we get together and decide, well, what is it that we think we can do that would be most helpful. And so families are included in it starts with a conversation with families. They're included in decision making along the entire journey. And then at the end we decide, okay, these are the things that we need to help with, or you want to work on. Let's get started, and then we go to work.
Yeah, that makes a lot of sense. And when I hear you talk about that approach every time, I'm like, why aren't other clinics doing this more often, right? It just makes so much sense to do the listening part and the investigation part heavily up front. Like kind of like building a product, you do the design investigation part intensively loaded up front, and then you make sure that when you actually make something, in this case, when you deliver the care, you're delivering the best possible care that you can deliver, and
Yes.
hopefully understanding about wellness. So that's,
Yeah.
oh, sorry, go ahead.
No, I was just going to say that one of the coolest outcomes that we see is that kids understand themselves. We really work hard to help kids understand themselves, because what we're learning about the child, a lot of it is not necessarily going to change a whole lot across time, right? So if the child understands it, I need a little bit more time to read a paragraph, and it's not because I'm not smart or stupid. It's because my brain takes a little bit longer to process that information. I mean, that's really different than I can't read, I hate reading, I don't want to read. And that
Right,
has an impact across their whole life.
right.
So yeah,
Or
it's
maybe like I'm a little bit of a slow reader, I need a little more practice in that, at that time,
exactly,
right?
yes. Yeah.
So that gets to the next, I think, major topic that I want to explore with you, which is, bringing it back to the now,
Hmm.
right? So we're in this situation right now where there's a lot of folks at home who are kids and adults who are struggling with a lot of changes in routine, and a lot of just sort of uncertainty, that is, more common now than it's been for us, probably, many of us, in a very long time.
Yeah.
And I was wondering if you could, for a moment, maybe briefly talk about some of the most common challenges that you're seeing kids have at home right now, and what can parents do to help?
Yeah. I so I still do a lot of clinical work. So I talk with children and families all day, most days of the week. And I would say, hands down, one of the biggest challenges right now is school. It's how do you manage teaching your child? I mean, parents are being asked to be teachers. Parents are trying to work at home. There's this whole kind of set of expectations that really haven't changed. So one of the things that we're looking at very carefully is and figuring out ways to respond to is, we take kids and we send them to school, and they're really young when we send them to school, and we tell them, this is where you learn, this is the learning environment, and they work hard to accommodate to that. Uh,
Right.
think about kindergartners. They don't want to like sit at a desk and listen, and they're like, we want to play. So we really teach and structure them a great deal about this learning environment. And they respond, they get everything they have. And what's happened is that they have habituated to that structure. That's what they know. That's how they know to learn.
It's what they practice.
Yes. And now they're sitting at their kitchen table, and none of the guide rails are there. None of the
Right.
visual cues, none of the sound cues, none of the things that they've come to rely on to help them mentally manage a school day. And so, that's really tough. And I think, in the beginning it was new and there was a little bit of novelty to it. I had lots of kids who were doing better in the first 3 months of quarantine because the social aspect of school was so hard for them. So they were actually doing great. And I had a group of kids that were just already starting to feel really isolated and lonely. So I think the combination of school and lack of connection is really driving most of the issues for kids right now.
Have you have you learned, I know because we as clinicians, we learn a lot from our patients, our clients. Has there anything that's come up as strategies for navigating this?
So yes.
And before you answer that question, I just want to let everybody know, because I forgot to earlier, that we will be devoting the second half of this conversation to Q&A. Starting, we'll have about 30 to 45 minutes of Q&A. And we are set that much time because we want to answer any and all questions that we can from you. And we really appreciate you joining in. So stick around for the end. And if you have questions that you would like to ask, you can post them in the Q&A section of the Zoom call, and we will log them accordingly and make sure they get addressed. All right, Amy, back to you.
Okay. So I have a whole clinical team that, every meeting we have, we're asking the question, how do we do this better? How do we deliver this virtual care better? What else do we have? What can we help with? There's some low hanging fruit here. So a lot of families early on created a space in the house that was the school space. So the school, this is the room where you do the work, and every other space in the house is where you live your life.
Creating structure.
And I think that has been really helpful for some families. The other things that have come up are how do we manage the kind of environmental stuff that's going on in any given day when the child's trying to go to school? So sound and dogs barking and, construction outside or inside, or just, being in a house with 4 other people, living a life while the child is supposed to be paying attention. That's been challenging. So some of the sensory interventions that are really common to families with kids with autism, we've also extended out to lots and lots and lots of children who find it challenging to stay with the teacher on the screen or the structure of the room when there's so much else going on outside. So that would be white noise or noise canceling headphones, or making the environment really kind of grounding for the child when they're expected to be paying attention.
Yeah, those are really good, simple suggestions.
I'm looking around for it must be downstairs. Simple things like we had a rice sock making workshop, and we used just regular rice and a big long sock, the longest you could find. I was looking for mine because I had it up here.
I remember making those in school.
And so the weight of it is really what we're after. And you can use essential oils for smell.
Oh yeah, lavender is really great to calm down.
Yes, yeah. So and then there's also, rice is a moist, like when you heat it in the microwave, rice gets very moist, so it releases this kind of warm, moist heat that's great for either around your neck or in a child's lap. So just always asking the question, kind of, what else can we try? What else can we do? Families have been incredibly creative and are working so hard to make this work for their kids. It's tough. It's tough right now.
Yeah, and it really is, and our hearts are out there for everyone whose kids are struggling right now, because this is a really hard time. And when really taking a look back, I think it's important for us to recognize that this is a hard time, and it's hard for everyone. And the best thing that we can do is really focus on being supportive of each other through the process, and understanding how to use all the tools that we have at our disposal. Ideally, the cheap and free tools first, right? The least invasive tools that empower us to feel better on our own, that don't require a clinician. And then if you need a clinician, we're always here for you. But
absolutely, yes.
And also with respect, the rice bag is an incredible idea because with the essential oils, you can add whatever little thing you'd like to do it. I'd also like to shout out to Bed Buddy, which is a great thing that you can buy on the interwebs that is, I think it's like $20 or something. And it's also like a microwavable or freezable bag of something like rice that you can put on your body. And relax the body. It's really great. Even just, and so that actually reminds me of the next thing I wanted to get to, which is, the other things that people can do for each other at home, especially that adults can do for their kids, things like more hugs, right? More like soothing, gentle touching is really calming to kids. Teaching them breath work when they're young as one example of like learning to feel in control, because correct me if I'm wrong here, because I'm coming at this from an adult psychiatrist perspective, but I get the impression, based from an adult psychiatrist perspective, I would say that most adults, the source of our anxiety comes from spending more time, more percentage of our attention thinking about things that we don't have control over, rather than thinking about things we do have control over. And does that make sense?
It does, yeah.
So do you see the same thing with kids, and do you see like, because I've always thought the importance of teaching breath work young was so critical. Not that adults can't learn it, it's just much, much easier when you're young. Do you see that, the breath being our most fundamental thing that we have control over in our own bodies in any moment? Do you see that as being useful here to help kids feel more in control and self-soothe?
Yeah, absolutely. So while I have worked with adults in my practice, we still do. We treat the adults.
I didn't know that.
To come to care. Yeah. So we also work with adults. It's way more fun with kids, Dave, I gotta tell you. So teaching breath work to very young children, it usually happens with bubbles. There's a lot of bubbles involved with that. And so you're teaching them to exhale, blow the bubble out, and then inhale, and get ready for the next bubble. The other thing that there's some great books. If we take a break, I'll look for the references. But there's some great books about teaching children breath work and stories about using breath to manage fear or anxiety, things like that. So it's so important, and it's also really fun, which is what I love what I do. Who gets to go to work and blow up balloons all day and blow bubbles, and it's great.
The breath work is so important to the kids because it's something that they can tap into at any moment and say, and remind them that they are safe, right? That they're in control of how they feel in this moment, which is something that I think just, in a lot of ways comes more naturally to kids. And when we teach kids breath work and kids and younger people to meditate from a younger age, it becomes much easier to enter those states where you feel like you can basically rapidly restore your inner homeostasis or balance, right?
Yeah, we asked that question early on. A lot of the practitioners, a lot of the clinicians at CICS are really interested in alternative strategies to manage central nervous system excitement. So breath work, breathing, meditation, mindfulness, all of that is something that is kind of a fundamental value and core of what we do, of the work that we do. And so early on, we asked the question, oh my gosh, how are we going to teach very young children mindfulness? How does that work? And so over time, we've been doing it for about 6 years. And I'm so impressed with kids. I'm so impressed with what they do, what they're willing to do, and how they learn, and then how they turn around and use it. So we have a fair number of clinicians who use mindfulness as a practice in work with kids. We also have mindfulness groups, and there's probably an element of that running through just about everything we do. For that reason.
I don't mean to interrupt, but I was wondering, would you mind just describing some of the things that you've seen? And don't feel free to not let me put you on the spot, but some of the things that you've seen with mindfulness and breathwork techniques when used properly in kiddos, or by kiddos, I should say, because they're doing it themselves.
Right.
I think a lot of people want to, like, they're kind of like, what is this going to do? You know, like,
what does this look like? Yeah. So I can tell you that it's really about teaching. It's awareness of body and awareness of breath, and teaching the child to be present in their body, grounded in the moment. And the work of it is practice. And so doing this kind of work with young children, the additional layer is making it interesting or fun. It has to be kind of novel, right? So you have to, I can't sit with a child in a room with, quiet and low lighting and practice mindful meditation like that. That isn't going to happen. So we've used some biometric feedback, and it's pretty easy these days because lots of people have wearables that measure things. And so sometimes it looks like, let's play the game of, can you move your heartbeat? And so, okay, so this is how it goes. You're going to sit and you're going to think about things that are really exciting, and you're going to feel it in your body, and you're going to get really excited. And what does your heartbeat do? And then, okay, now let's bring it back down. You think you can do that? You have to be really calm on the inside and focus on your breathing. And so it's practice. And the challenge with kids that I love is, making it fun, making it interesting, making them want to do it. Anecdotal stories, like fun stories to tell. I was in my office in our space, when we're not virtual, is in the middle of practice. And I did that on purpose because I wanted to be around. I wanted to see and hear and be a part of everything that was going on. So I was in my office doing other work, and I heard a child come running out of a therapist's office, and really upset, yelling, all that kind of stuff. And so I stood up to go out to see what was going on. And this is a child that I had worked with early on. And I said, "Hey, buddy, what's going on?" And he stopped. Like stone still, just stopped and looked at me and said, "Oh, I forgot to breathe." And I was like, my work here is done.
You recognized it on your own.
Right. I went back into my office. He went back to the therapist's office. That's one of my favorite moments.
That's so funny. Yeah, kids just get it, and it's so powerful. And I think what's so interesting about it is that it's not just for kids who are sick, and it's not just for kids who are healthy. It's for all kids and adults. Yeah. The breath work and the mindfulness practice, just even if we've never been taught it before, just making the recognition that it's something we should start focusing on starting right now. Right. And that if we focus on this for ourselves right now, it will translate into that knowledge being picked up by our kids. And if our kids have ADHD or autism or autism spectrum disorder or depression or PTSD or anxiety disorders of any kind, often this is one of the first and most powerful techniques that we recommend that works for these kids, that helps them really feel better.
Right. Well, and
improve their focus, right? Which is something that's really important right now.
Yeah. Yeah, absolutely. The ability to self-regulate, and we teach kids early that, you're in charge. So you're in charge, and you're in charge of your brain and what it does. And so the, teaching self-regulation when somebody's getting bored or somebody's getting distracted is really important. And first you have to have awareness. Oh, look, I'm bored. So you have to be grounded and in yourself to recognize, oh, I'm bored. And then have strategies to use to change that state. And so we use it in that way as well for attention and focus. So if I'm bored, I need to take a deep breath. I need to maybe stand up and stretch. I need to feel myself in my body, and I need to reorient to what it is I'm supposed to be doing. Like it's not rocket science. It's not like super high level, really, intense interventions. It's really teaching kids how to manage themselves. And we don't do that anymore, really, and especially in schools where there's so much structure in the environment that they it's kind of almost a default mode. And then they come home and, the guardrails are off, like game on. And so now we've got school at home, which is tough. So.
Right. And so this is all so important to talk about, because I don't think, frankly, from what I'm hearing, at least on my end from the parent side, that people don't have a lot of other people to talk about this and ways to sort of strategize, like, how do we overcome these challenges that the family, us, and our kids are facing right now.
Mm-hmm.
And so I think this is a good segue into the work we're doing with Apollo.
Mm-hmm.
And one of the major ways that we started working together was that we just gave you a bunch of our prototypes and you tried it and you were like, oh, well, this clearly can't hurt anyone. So I'm going to try it out. I'm going to offer it to some of my kids. Could you tell us about some of your early experiences with Apollo? And then maybe we can start talk about some of the ways that people can use Apollo to optimize their situation right now with their kids?
Yeah. So we were the first Apollo that we got was actually in the sub pack form factor. So it was, the
It was
backpack.
before we had our own wearable. That's how
Right.
far back Amy goes with us.
Right.
She's dedicated.
Yeah, and so you shared it with me in Pittsburgh, and I used it for the ride home because there was a time when I was doing a lot of driving back and forth to Pittsburgh, and I used it for the ride home, and I loved it. But I also realized I didn't drink any coffee on the way home, so it was, and that was something that I had wondered about. Like I set it to the awake wave and get work done wave, and but I didn't drink any coffee on the way home. So I took it to the practice, showed it to people, said, hey, what do you think? They tried it, clinicians, and then I said, okay, let's try it with kids. Let's see if what they think. And I'll tell you, there's a subset of kids that just love that big input from the sub pack. There were also an equal number of kids that it was too much, so I'm glad you have the wearable.
And just so everybody understands, before we actually had our own wearable, this is going back into, I think, 2017 now, when Amy and us started working together. It was actually before Apollo was even a company. And so it was way back. And we were still in our research team phase at the University of Pittsburgh, and we had just gotten our first incredible results from our first double-blind randomized placebo-controlled trial. I think the results were just starting to come back, and we were having incredible results with respect to safety, and the rhythms or the modes, the frequencies that Amy is talking about using in the original prototype are the same frequencies, but now optimized in the new wearable that you all have. So the experience that we're testing is the same, but in the beginning, before we had a company, we also didn't have any money for anything but research, and so we had to be scrappy and use every other people's wearables when we could.
Right.
Now we've shown that the new wearable works much better and consistently. But sorry, I didn't mean to interrupt. I just wanted to catch everybody up.
Yeah, no, I think that's important. I forget, I just, when I start talking about it, I go that far back, and I forget sometimes that everybody doesn't know the story. So we use that first form factor, and I had the experience as a clinician. There was a little girl that I'd been working with who had carried the medical diagnosis of ADHD and autism, and I had actually never had a full conversation with this child. She's capable. She didn't have severe language issues. It's that she just couldn't sit still. She just could not sit in my office. And it was very hard for her to stay focused on the topic of conversation. So I did a lot of work with her, and she had some success. And we had a way of working together in the office that involved a lot of movement and games and toys, and so I kind of met her where she was, and I knew she was going to like this just based on working with her. So I said, hey, do you want to try it? Yes. We put it on, and she played with a couple of the different rhythms, found the one that she really liked, and then sat on my couch and just started talking to me.
And you've been
And
seeing this child for 2 years or something,
yes,
right? And
yes,
never had a conversation.
I was in shock. I was just like, this kid, I was in shock. And it was beautiful because I got to have a conversation with this child that I had been trying so hard in so many different ways, to be able to do that. So that was actually, I think, that might have been the first time I used it. If it wasn't the first, it was close to the first. And so then we just repeat it, repeat. Who wants to try it? And we had, we had a system in the practice where you had to sign it in and out, and they were only allowed to wear it in sessions. And there was so two things that kids would fight over at the practice, or that they would be very excited to use: the Apollo and the hairless guinea pig. So I actually had to go get more guinea pigs because I didn't have enough of the tools to go around when kids really wanted them. We were busy, so we had a wait list. Like, can I use it next? I need it. So that was, early on. And then when you got the wearables, you just gave us some, and we did the same kind of thing, only much more structured. So back then we were doing it with therapists in session. So we were just using it in session.
Would you, before we go to the next study, would you mind just talking very briefly about the study results from that initial first session with the therapists only in office a little?
Sure. Yeah. So there were, so we are very invested in evaluating outcomes. And so we take good notes, and we have some objective measures that we use. And there was clear improvement in, I'm trying to remember the document that we produced. So decrease in anxiety.
Sorry to put you on the spot. That was a pilot was a while ago now.
I know, like, okay, but I got it. I remember. So we had some measures for anxiety and measures for attention. And there was a significant impact on both in session with therapists. We also, at that point, were asking questions like, is it tolerable? Will the kid wear it? Is there anything they don't like about it? Is there, and so back then, we learned those things. We learned that kids, it is very tolerable, and lots of kids really like it. They like the input. The wearable has just gotten better across time. Like, every time you guys do a new one, I'm so excited because it's just that much better. And so those were the early outcomes that we were seeing. We were seeing kids more engaged in session, having an easier time, participating, communication got better, measures of anxiety went down, and there was a lot of tolerability, a high level of tolerability.
Yeah, and that was really exciting. And ultimately that data, which came back, I believe now in 2018 originally, or I think it must have been the end of 2018 or the early 2019. It's all blurring together now.
Yeah, it is.
But because those results came back, I think it was in like 14 out of 15 kids responded in the way that you just described, which was very significant. That we realized that this is just such an important tool for kids to have access to, because it's safe and can be used as a first line before drugs, which now are currently, for a lot of children, the first line in many places, which have side effects and potential risk. So do you want to talk about the next phase of the work we did?
Yeah. So level 2, round 3 at that point was sending the wearables home with the kids. And so a lot more structure around what they felt, and data collection around how they felt it was an impact, or it supported them, parent input, a high level of parent input about what they saw at home. And at that point, we had kids who wanted to take it to school, and we were able to do that. We had a couple of kids that were able to take it to school, and then we asked teachers what did they think. And the hands down, we had very positive responses in terms of both, again, the experience of the child. it was so hard, David, at a certain point, because I was the person who had to ask for it back.
Right.
Right. So I was both the giver and the taker, and that was hard. I had some kids who really didn't, they wanted to keep it, really didn't want to give it back. So from the child's perspective, there was an impact on how calm they felt on the inside, and a happiness kind of factor that they reported, just like feeling generally happy. For the parents, it was, an impact on the amount of time that they felt like they engaged in negative, responses to their child, like correcting behavior, having to set limits, or give a punishment. So a pretty significant decrease in those areas. And then an increase in performance is how I think about it. So areas where kids were able to sit longer, attend more, be more successful with work.
Yeah, that's really, it's really incredible what you've been seeing with, in the work. And I'm so excited that we're finally now getting to a point where the work has been so promising. We're actually expanding it out to a partnership with Michigan State University. We had one really quick question that ties into what we were just talking about, which is, what metric did you use for anxiety when you were doing these studies? Do you remember? Was it the GAD-7? Or
it was the pediatric version of the GAD-7. Yeah. So there's a child version, and that's the one we used.
Got it. Yeah. So we used the pediatric GAD-7, and then also in the other side of it, where you're actually seeing, and then you also have reports from the parents that are talking about anxiety,
Right.
reports from the teachers, and then the therapists themselves on the therapist side, right?
Yeah. Yes. So when we were doing more structured data collection, we were using areas of the Vanderbilt rating scales. We do that routinely in practice. So we had, the reason we picked those measures was because we were already using them. So we had some good baseline data to compare to before we implemented Apollo. But that's what we used. I can't right now. I'm not thinking of anything else in those early days.
Yeah.
Clinician report. We surveyed the clinicians. We did a satisfaction, tolerability kind of questionnaire, things like that. But the clinical data was pediatric GAD-7, child GAD-7, and some of the subscales of Vanderbilt rating scales for ADHD.
Yeah. That sounds about right. So with that, I think this might be a good time to move to some of the questions. We have some good ones coming in here. Let's see. Our kids are going to school in person. Do you have experience with kids using Apollo for focus in a school setting? Any advice? That's it. That's the first question.
Wow. Okay. So we started to answer that, and the answer is yes. And our pilot, we had kids take it to school. That form factor was a little different. So we had to, make some adjustments around the cell phone and things like that. But it was not a problem. And actually, teachers were really excited. And the kids that took it to school were really excited to talk about it with their teachers and their friends. One of those kids did a science project on it. And presented it at the science fair.
Oh, that's so funny.
Yeah. So it was a seamless experience. I think, it looks like a wearable. So it looks like a watch, or, something, Fitbit, something else that a kid might take or have on them at school. And there were no issues. And how did it work? It worked well. Those children we had the benefit for those kids of getting teacher feedback, and the teachers said that they saw a difference.
Yeah, and I'll just echo that in the real world participants with kids who they buy their Apollos for and then tell us about their experience, we have seen some really fantastic reports of kids improving their performance in school, just being able to focus in school. One of the nice things about Apollo is that we designed it without a screen so that it's not distracting for kids and for adults, but really not distracting for kids. And so kids will oftentimes wear it to school. And even if they don't have a cell phone, the way the device is set up is that it works without the phone.
Right.
So you can preset the Apollo to whatever your child's favorite frequency is for school days, either at home or I would say I would do this practice whether your kid is at home for school or just to keep the structure, because as Amy and I were talking about earlier, structure could not be more important for your kids in homeschool right now, or remote school. But basically setting typically the favorites for the day are for kids, most kids are social and open or clear and focus. And setting one of those on the Apollo then locks it into the Apollo for the day, even when the Apollo separates from the phone. And so then when your child is in school, at home or away in school, even if they don't have the phone around, they can just tap the buttons on the side of the device one time, and it'll restart the last mode they were on, so they can get a boost of feeling in control and settled whenever they want. So that we in a lot of ways it's been, we designed it for that purpose. So a lot of people have been having good results with it, which is really great.
Yeah, that's amazing to me. I mean, that the latest version is amazing. So I feel like you guys have thought of everything. So how do we help kids make choices about what works and doesn't work for them once we figured that out? How do we get them through a time frame when they're not with parents, when they're at school? And then how do we make it easy for them so that they don't have to think, learn a whole system, think out what's going on? So I think in that sense, it's really your newest design is fantastic.
Oh, well, thank you. I mean, I credit highly, and I know Catherine, my wife and the CEO, will also credit people like you and the folks who are joining us on this call who tell us what they think, because we don't know all the answers. We do the best we can by talking to you and asking questions about what you like and what you don't like, and then we just try to make it better. So rest assured, it will continue to get better over time. The more that you tell us, the better. I think we did address this question, but that came in a minute ago, which was about needing a cell phone to use the Apollo. You do not need a cell phone to use the Apollo. And the Apollo can be worn on the wrist or the ankle. However, it works anywhere on the body from what we've heard and from what we found in the lab. So if your child would prefer it on the arm or part of the leg or something like that, that's fine too. And we also now have child size straps available. So up until recently, we only had adult straps available for small adults and large adults. But now, since the results have been coming back from Amy and other studies that have been looking so promising, it was clear that we needed kids straps. And so now those are available on our website. And you can order those if you like. One of the other questions was that what tips would you give somebody? So, somebody asked a really good question that was about when you're already stressed out, you're already overwhelmed, right? Like you and I get this question all the time, and mind's racing, can't settle down. It's really hard to manage to get control of our executive functioning to, in that moment, be mindful, or in that moment, take a breath, or even, some people, even I sometimes, I'm guilty of this too. I even forget to turn on my Apollo in those kinds of situations. With Apollo, we're working to make it automatic so that you can schedule it and that will be resolved. But what other suggestions would you offer to people who are currently in this kind of situation where they're really overwhelmed and sort of feeling like, hypervigilant, sympathetic, fight or flight mode, intensity, and what can they do to sort of step down from that and allow recovery to happen?
For parents, especially, so adults or kids?
I mean, for the sake of both. I mean, for the sake of this conversation, I'm generally just focusing on the kiddos.
On children, okay. Yeah, so I think it's important that families learn to recognize the difference between what you described, and we have all kinds of words for it or ways of talking to kids about it. The wild woman within, all kinds of fun things. But recognizing that sometimes when a kid is hyper aroused, really, really ramped up,
Mhm.
they're no longer in control. They can't control what they're doing. And that's tough, because it's those minutes when kids say awful things, or if they're going to be, physical in that moment, they'll throw something or stomp, or, and there are times when the appropriate intervention is to do nothing. That the more you feed, when you think about a kid in that state, the more you do to try to bring it down, you're actually feeding it and helping it grow,
Mhm.
and persist. So it's really important for parents to start to learn those differentiated states for their kids. So an easy way to do that is ask if your child is hyper aroused, angry, stomping their foot about something, and you ask them to do something, if you can redirect it, they're still in control. If they don't listen, don't care, just continue in their persist in that state, they're really not able to change it themselves. So, small interventions, changing the environment, changing sound input, changing smell input, changing light input, bringing things back down environmentally. If the child is saying, leave me alone, I leave me alone, I need space. You're not enabling them or giving them what they want when you honor that request for space. And I think that's really hard for a lot of parents, because we want to help, we want to stop it, we want to change that state. And so there's a whole level of learning and understanding for parents that's so important to help their child in that moment, when they can't control it, when they can't self-regulate.
Right. Focusing on the things that helping our kiddos focus on the things they can control in any
Mhm.
given moment, kind of going back to what we were talking about earlier. And sometimes even, I mean, correct me if I'm wrong here, again, I have my adult psychiatrist hat on, but sometimes a hug is the best medicine, right?
So yeah, and I'm always, again, you're going to hear me say it over and over, but and it's the foundation of parent-child interaction and relations. Not all kids like that input. Not all kids like a hug. Not all kids
Mm,
want a big sensory input when they're losing it like that. So it's really the most important thing you can do is learn what works for your child, and then honor that. Do
yeah.
that.
Oh,
Um,
yeah. Yeah. Makes perfect
so, so when I think of a hug, I think of a really awesome sensory input. It's
sense.
big, their whole body, it's warm, there's pressure, there's a lot of brain activity that's happening with a hug. And in the right kid, it's all they need. That's all they need in the moment. In a different child, it can make it worse, not better. So it's really important to understand your kid. And then yes, those interventions that are simple, easy, and in the moment, that help them regain control.
Right. Right. Yeah, that makes a lot of sense. And I think we actually make this mistake too sometimes in medicine, where we feel like we have to do something, or even in a conversation where somebody
Mhm.
is expressing that they want help. And oftentimes they just want to be heard. They don't necessarily need us to do anything. They don't need us to fix it. They just want to be heard. And the
Mhm.
fact that we can let them know that they're being heard and that they're understood and that they're safe in that experience of distress is, as you said, knowing what they need to feel better, and that's so important to calming down from those situations. Um, I think there's a couple quick questions that I can tackle real fast here. One of them is there any data on long-term use with Apollo, and does it remain effective? Um, Amy, you could probably talk about this a little bit with what you've seen with kiddos. I can tell you that with adults and what we've seen in the real world and in the lab trials, we have done a lot of long-term studies with people in the real world looking at a year long of use. And we've in thousands of people, and we found that people continue to use it and continue to feel that it's sensitive. They're sensitive to it over time. Interestingly enough, similar to meditation and breathwork practices, there's what we call a learning effect. So when you learn to breathe, sometimes it takes you maybe a few hours, days, weeks to feel a significant change in your body just from doing a breathwork exercise. But then as you learn to do that exercise and feel calm in situations that used to be stressful, all of a sudden it becomes really easy to access that state. And the more we practice it, the easier it gets to access that state. And the more sensitive we get to that state. And from what we've seen so far, Apollo responds in the same way because it's activating this natural neural pathway of touch in the body.
Yeah, I would say that that's the same is true for children. One of the things that I really love about this as an intervention is that kids begin to see success, and success is kind of a self-fulfilling prophecy to a certain point. So they use it, it works, they feel better, they get a good result. They use it, it works, they feel better, they get a good result. And that's kind of it's like the upward spiral. And I think that has been true across time for kids who have asked to use it again and again and again. And so that's been our experience in the clinic.
And I think it's also important for those there probably are some people here who don't know, who don't have an Apollo or haven't really used it yet. And for those people, I think it's really important to note that Apollo, yeah, you got yours. I have mine on too. I wear it every day because it, makes me so much better in what I do, and just sort of keeps me in flow and feeling good and focused. And having it maybe at one time in my life, having been, on something like an ADHD kid myself, but I had to learn I didn't have any medication. So, from any doctors, I learned how to focus through it on my own and retrain my brain. Which was incredibly difficult, I will tell you, especially after getting through all that school. But eventually you learn how to do it. And you have to have the right facilitators along the way. I think that, for those who aren't that familiar with Apollo, the device that we just showed you can be worn on the wrist or the ankle. It delivers very gentle vibrations to the skin that kind of feel like an ocean wave washing over your body, or they feel like a cat purring on your body, or like somebody giving you a hug without the actual hug. And the body responds to the vibrations in a very similar way as it does to those feelings, where it interprets the vibrations as soothing. And then that results in an increase in our lab studies that we've shown of parasympathetic tone, which is basically, in short, activity in the recovery part of our nervous system that then counterbalances or shuts down overactivation of our stress response system that's causing us to feel overwhelmed, distressed, out of control much of the time for some of us. And so Apollo's divided into 7 modes. The most calming is the sleep mode, which is actually the most popular mode. The second most calming is the relax and unwind mode, which is great for just winding down at the end of the day. The third most calming is the meditation and mindfulness mode, which a lot of people use for pain. A lot of kids have used for winding down the end of the day, or learning to meditate and learning to breathe timed with that mode, which has been really effective for a lot of kids. And then Rebuild and Recover kind of sits right in the middle. Rebuild and Recover is kind of where the energy and the calm are roughly equal. For people. So we tried to aim for, again, based on what we learned out of the research lab at the University of Pittsburgh, how to use these gentle vibrations, which are basically music that we composed in the lab for your skin rather than for your ears, that helps to nudge the body a little bit up towards more energy and more wakefulness, or a little bit down to more calm and more relaxation, depending on what your goal is. Somebody asked me, which occasionally I get, what percentage of people does this work for, and what can I do if I don't understand, if it's working for me? And the point is that ultimately it works for about 90 to 95% of people if used in the way that we recommend. And I posted the recommendations here in the chat for everyone on best use guidelines, based on us aligning our goal with the energy level, right? You would never drink a cup of coffee before going to bed with the intention of actually falling asleep. right? So a lot of this is Apollo balances our nervous system to make it easier to transition into a different state, but then also helps us using the gentle vibrations, but also helps us to stay balanced and then to return to that balance as needed.
Mm-hmm. One of the things that I would add to that real quick is that I just was remembering an experience where a child came into the office and put on the Apollo and said, turned it on and said, it's not right. It's not right. And I said, what do you mean? And so we cycled through all the different choices and we hit the right rhythm. And the kid was like, that's it. My brain remembers it. It was really neat.
Yeah, in some ways, the kids are more sensitive to it than adults because they feel it and they remember what it feels like. I will never forget the day we told you the story. I think we probably showed you the video. I will never forget the most dramatic experience I've ever had with Apollo was when we put it on our 3-year-old niece at a holiday party. Mm-hmm. And she's running around. She's so adorable. And she is holding it in her hand. And I said, hey, what does this feel like to you? And she looked at me kind of like sheepishly. And she's like, this feels like kisses. And then without telling her, and then she was just kind of smiling and it was so cute. And she's like running around. And then without telling her, I changed the mode to see if she would even notice. Mm. And she comes back to me without me even asking her to come back. And she says, looks at me right in the eye, so seriously. And she's like taking my question so seriously as a 3-year-old. She's like, and now it feels like hugs.
That's the best. Yeah.
She's like, it feels like kisses and hugs. And she's like trying to figure out, you could see how her 3-year-old mind is trying to figure out, like, it's incredible. But for her, it was like almost automatic. There was no barrier to the understanding, which is so interesting. And I just reposted those guidelines for everyone who missed them earlier, the best use guidelines. They're on the Apollo website if you go to the blog, so you can always check that out, apolloneuro.com. And there was another good question that came in here that I think is going to be, I think is really going to benefit from your expertise, Amy, which is for teens who are dealing with multiple things like depression and ADHD and anxiety. Should they cycle through different modes all day? And I could jump in here too, depending on their mood, or is it better to stick with 1 or 2 modes? Have you noticed any patterns yourself or in the kids who have been using it, what they said?
I'm just trying to
or more generally, any ways or that they've used Apollo that has been more or less helpful.
So I would say that in my experience, adolescents, younger to older adolescents, do a good job of shifting states once they learn how to do it, once they recognize it.
Right.
So, you know, the younger kids, there's more of a sometimes a need to say, okay, so for this amount of time, you're going to be on this wave. But adolescents are really good at learning and then using how to shift states.
Do you, the state shifting is so important in terms of just allowing, letting go of that resistance to the way things are, which actually results in a lot of anxiety reduction for us in the long run. I think that with respect to, there was, you do some work with the microbiome still, right?
Yes.
We have not yet. Somebody asked an interesting question about, can the Apollo help someone with terrible gut distress or intolerances to foods? We don't have any evidence of this yet, but we are working on studies of Apollo looking at the microbiome before and after Apollo use, because this has become something of incredible importance to health. And do you want to talk about that for a moment and some of the work that you guys are doing?
Sure. Yeah. One of the so the microbiome is something I've been following for probably the last 10 years, just, you know, watching the science evolve and emerge. And so probably 3 years ago, I went looking for, you know, who's doing microbiome testing, either clinically or direct to consumer, what's the landscape look like? And what I was after was trying to incorporate microbiome data into our understanding of kids. So in several ways, and I mentioned that when we first started talking. So related to the genetic variations that can affect the way our brains make and use brain chemistry. When I understand that, often the recommendation is a supplement, like a special B vitamin or an omega-3 supplement. We're always checking for vitamin D and low vitamin D and supplementing there. So we're not just looking for that information, thinking about medication. And the microbiome would be the same. So really trying to find and come to an understanding of ways that we can help physiology regulate to its highest level of function. And so the microbiome, we actually are also going to do a study with a company looking at the impact of microbiome and supplementation on some of the symptoms of autism. So I am always looking for more data to understand a human. That's just kind of what I'm looking for. And, I think that the impact of Apollo microbiome from just a human systems perspective, it makes sense, because if you're regulating your states of anxiety and distress, you're also there's the feedback loop for stress hormones and what's not getting released and the impact of blood sugar. And, all of those systems include microbiome, aspects of microbiome. So I don't have hard evidence to say that, yes, these two things go together. I can say that, I'm interested in finding out more.
Yeah, I think we all are with respect to the microbiome. And for those who don't know what that is, the microbiome is the flora and fauna within our gut. So all of the bacteria and normal levels of viruses and other organisms that exist inside our gut that help us metabolize and break down food effectively and build immunity effectively, which are often, or in some cases, dysregulated in mental and physical illnesses. So there isn't any evidence that Apollo changes this yet, but we know that it has a role in mental and physical health. So that's why we're interested in it, and we are exploring it. There's a question from Whitney. What does the Apollo provide that is your favorite aspect or attribute, tool, or feature? And secondarily, well, let's go for that one first.
Okay. So my favorite outcome of Apollo, I guess, is how I'm thinking about that. I would say that my favorite, I have two, and I'm not going to be able to pick between them. So, so my favorite is when a kid, when a child says to me, like, I feel so, I'm calm on the inside. So that resting state, that kind of, relaxation, going to rest is, I think, so important. And the other is the attentive state. So that wake up state where, the child will say, wow, I that was so much easier than I thought it would be, or I got through that faster than I expected, and I really felt like I did a good job. So I think those are probably my two favorites.
Yeah, that's really great. And I'm so glad to hear. It always warms my heart to hear you talk about your experiences with this.
Me too.
Yeah. I can't wait till we can actually get these out to children en masse, because if we're having the kinds of results that we're having, and then we're going to see that unfold, hopefully we don't have any reason not to expect it in our, the larger phase of these trials that we're doing. It's all very exciting to just be able to make this more accessible to children all around. And sorry, go ahead.
I just want to hop in because we haven't really touched on this, but I think it's so important. So we have spent a lot of time talking about the kind of functional and integrative things that families can do to help and support kids. And, medicine is always second tier for us. That's just, we never meet a family and we don't prescribe on the first visit. There's a lot that we we don't do around medicine, and sometimes we use it. And so, I think it's really important for families to understand that there's additive value in interventions. And so one of the outcomes that we're looking for is less use of medication. So maybe you still need some, and maybe you can use less. And I think that's really important. Some of the medications that we're talking about are highly effective, and also, create a whole other set of things to think about long term in kids. So even if you're in a situation where you feel like my child is regulated, on medicine, and I know what it's like when they're not taking medicine, and I'm one of those parents. I mean, my daughter has been taking medicine for a while. And I know what she's like off medicine. It's not necessarily a full replacement. It can also be an augmentation. And I think that in, some kids, the ability to learn to self-regulate then leads to no medicine, the need for no medicine. And in some kids, you can start here and they really get it, and you never have to go to medicine.
Right.
But when we talk about it and I think about it, this is a fantastic tool, and it's augmentive in everything, with anything else that you're doing.
Yeah, I agree. And as a psychiatrist who works with a lot of patients, adult patients with addiction disorders, PTSD, a lot of veterans, I always try to use treatments that don't have side effects first, because they make the biggest difference in helping someone actually learn, as Amy was saying, how to heal ourselves, how to care for ourselves in a way that promotes healing. And this is absolutely possible with tools like Apollo, and the trials, the ongoing trials continue to show it, which is very exciting. So, I think it's really, important to think about, not that medications are bad. I have lots of clients that I also prescribe medication to, as Amy has clients that she has to. There's no other option to prescribe medications to, but it's great to have alternatives, and it's great to have alternatives that we can use on the first line that are safe.
Mm-hmm.
There's one question I wanted to ask you, Amy. I don't know if you know the answer, but I want to help this person. Somebody wrote in a question asking about a child or young adult that is displaying early psychotic symptoms. Now, this is a very delicate situation, as we all know, and it's very tricky to deal with these situations, to make sure that these kids are okay, and especially when they don't talk to us very much.
Right.
So do you have any thoughts on that, with or without respect to Apollo?
Yeah. There there are so many questions. I have way more questions than I have a blanket answer right now, because I do think it's really important to deeply understand what someone means by soft psychotic or soft psychosis.
Well, how about addressing it from the standpoint of assuming that we already know that this kid is like that the kid is in the prodrome, right?
Okay,
So
right.
the kid has entered the psychotic prodrome, where they're definitely experiencing, they've been seen by a professional, and they're definitely experiencing paranormal phenomena that are beyond the realm of what we consider normal.
Got it. So in my experience, and I don't have deep experience in this area clinically. In my experience as a clinician for 30 years, one of the threads of that state for a kid, a young adult, is tremendous anxiety. So
Right.
regardless of the thought, or the experience of hearing, seeing, feeling something that others don't, it's very anxiety provoking. And so in that way, I would think that it could be really helpful. The other thing that's common in that time period is difficulty sleeping. And so again, when you're talking about achieving, this regulation and transition from state to state, having something that can kind of ease your brain into a sleep state could be really helpful. In terms of the psychosis, in terms of the thought structure, I don't know the answer to that. I really, I don't.
Yeah, that's a really tough situation. I mean, I reached out to this person directly through the Q&A, and I recommended them some things that they can use. There's some really great CBD products that if you use, not all CBD is equal, don't get me wrong, but there's one particular product that's really incredible that this product is safe for kids and adults. And it's organic and non-GMO and a really incredible product, and it's very cheap, and it's great for mood stabilization. We've had a number of folks who have sort of on the verge of psychotic instability, especially when it's in response to drugs, use this and have great benefit. And I often recommend this in my practice. So I posted it here in the chat for anyone who's interested. And for those who don't know, also, I think somebody asked a question about, is Apollo noticeable, the vibration? And Amy and I would laugh because we definitely notice it. We use it frequently. It is certainly noticeable. However, the best range of intensity that it works is usually what we call the sensory threshold. So this is a spot in our sense of touch where we just start to notice something touching us. So that, and I appreciate whoever asked this question, because this is actually the most critical part of the Apollo experience, because right now in the current Apollo experience, this is the primary way that the user, your child or you, can adjust the Apollo experience, right? And the whole point of the Apollo experience is for you or your child to feel more in control of how they feel, right? How you feel right now. So when you present, when you present this to your child, if you do so, we always recommend, and I think one of the most important things is to recommend to your kiddo that this is a tool that's a state-of-the-art wearable science, like neuroscience technology, that is not to treat an illness, because it's not. We do not have FDA approval currently to treat illnesses, and we do not say that we treat illnesses. What we do is we help rebalance the nervous system to help you feel better. And that just so happens to have some pretty phenomenal outcomes in terms of symptoms of illness, but we don't need to talk about that with their kids. Ultimately, I think, as Amy mentioned earlier, applying a diagnosis to our children is oftentimes, I would say, correct me if you think this is a gross overestimation, I would say 99% of the time, it is worse for the kid to have and know what their diagnosis is than it is for them to have an understanding of their experience and their symptoms and how to deal with it without the label of the diagnosis.
Yeah, I would support that wholeheartedly. It's really, when you think about it, what we call it really only has stigma that comes with it. Right? So if we call it something that's a medical diagnosis of disease, we imply that this child is broken or sick or, broken or sick. And
has something wrong with them that they can't necessarily influence.
Right. And that isn't helpful. That really isn't helpful. So while it's important to understand how your brain is built, how you are built, how, for the child to understand that, it's critically important that it be from a holistic perspective, and they understand that they're not broken, that there's nothing wrong with them, that this is, part of how they're built. And there's some really amazing things that can come from that. And there's also areas of weakness that they're going to have to, to work on. But it's a completely different paradigm. It's a shift in thinking from there's something wrong with me to I understand me and I know what's right with me. And that's, I think, critical for children and my mission for the rest of my life.
Yeah, same here. And this is also no different than what we see in the adult world, right? Especially with adults with mental illness, it's no different with respect to how we work with people and how we are really fighting, and I shouldn't say fighting because fighting is not the right word. We're really trying to show people the love and the trusting relationship that they can have with someone like one of us, like a clinician who really genuinely cares about them, so that they can understand that they are the single thing between them and feeling better, right? Like, it's all in us. We have everything we need right here with our breath tools, with our physical exercise tools, with our cognitive tools, right? And then all the other, and with our family and friends and support systems, whatever we have around, our technology tools. These are all the tools that can help us to overcome whatever challenge comes our way. And with every challenge comes an opportunity for more growth.
Yes. Yes.
Not fearing failure, but like really welcoming, failing safely early, right? Mm-hmm. So that if you learn early and you make mistakes and that's encouraged, then you can, by the time it really matters and it counts, you've already gone through it.
Mm-hmm. Yeah, we call that capacity building.
Yeah.
That's how we think about it. We're building, always looking to build more capacity so that when something isn't going well or when there's a failure, that there's capacity to learn, and that's what creates resilience. So if you come out of a failed experience, a failure experience, thinking to, the child's thinking to themselves, wow, that didn't work how I expected, or whoa, that was really dumb. That was the wrong thing to do. And the follow-up is, wow, I learned these things, so I'm going to do it differently. That's resilience. I have an awareness of what happened. I have an awareness of what worked and what didn't. And I have solutions ready, at hand, to make it different next time. That's resilience.
Right. Exactly. And the ability just to know that we can bounce back from stress, right? Mm-hmm. When stress comes, you can't stop stress from coming, but when it comes, we do the best we can and we use the tools we have to bounce back.
Yeah. I had something quickly that I wanted to add about,
please.
Did you have a question, David? I'm sorry.
Oh, no, I said, please go ahead.
Oh, okay. A recent experience that I've had, and something that is important for families to think about and remember, is that ability to fail. And for whatever reason, and it could be coincidental, it could be COVID, it could, I don't know. I'm seeing a lot of kids who present with OCD-like anxiety. So lots of anxiety, and then very specific ways of managing it through ritual kind of behavior. Excuse me. And
that's our next question.
Oh, really? Wow. Okay. So we're psychic too. Yeah. So it's such it's a complex scenario when you think about it, that for someone who experiences, high levels of anxiety, serious anxiety, and they have created their own way of managing it ritually. And not to say that it's a great way or that it works all the time, but that's all they've had to manage it a lot of times. So working with a child to be able to shift that, they need to be able to practice and fail. They need to be able to practice and have it not work, and have the capacity to push through, to push themselves. We were just talking, I had a clinical consult before this, and one of the therapists and I were talking about how, this kid is working so hard, and he's doing a lot of practice and self-exposure. And he's only comfortable at a level 6. Like he can do things that'll take him to level 6 anxiety, but he can't push through past that. So we were thinking strategically, how do we help support that? How do we help him do something where he anticipates a level 8, and have the experience of being able to get through it, to survive it, to tolerate that level of distress, because you have to, that's part of the learning, right? You have to learn, kids have to learn that, yes, I have this feeling of anxiety and stress, and it won't last forever, and I can do something about it, and I've been here before and I got through it. And that's all the learning side of working with kids. So when I think of that, we were actually talking about all the different ways that we might help support his experience of level 8 anxiety. And Apollo came up. We were actually brainstorming around what that would be like for this kid before we talked to him about it. But I think that's really important that, there's, especially with serious anxiety, with serious, with an OCD component, it's really important that families look to find, and clinicians look to find ways to help kids balance that so they can develop capacity. They have to fail, but they also need to be successful. They have to experience anxiety and learn to manage it. And so to do that, they have to experience anxiety, so Apollo is a tool in that kit to help support that balance.
Right. If you don't know what it feels like, and you haven't sat with the emotion, like genuinely sat with an emotion, even though we might have been told it's a negative emotion, then we never learn to process and sit with those emotions and overcome them. And Apollo as a tool helps us to do that. And that's a critical part to all anxiety disorders and emotion regulation disorders, PTSD, depression, but in particular OCD. We see this a lot. Quick question for you, Amy, that I think will be a lot of people have been asking. Do you provide teleconference for young adults and kids? If so, what age groups? And I'll post the link now for people to find your website. Is that the best link? The Every Child, Every Time?
Well, it is. Our timing was a little early. So the answer is yes. Second, right now, that is the best way to get us. Our website's under construction, so we're launching a whole new website and system in January 11th. So yes, we do consults. Yes, we work with children and adults. I get asked that a lot. How old? What's the age range? And my joke is that, well, they always have to be born. They need.
Well,
I'll do.
What's the youngest child that you've worked with on like telehealth side?
6 months old.
Wow.
I would say. So, it's so interesting. We've been doing virtual care for a long time. This is not new for us. When quarantine hit in March, I closed a week before the mandate happened, and we had already converted to virtual care. We did it in 3 days. We took the whole practice to virtual care in 3 days. So I have my whole professional life really focused on providing access to good care because it's hard to find and access is limited. And so virtual care for us was a way of extending our reach and providing more access. With that said, there's a tremendous amount of assessment data that you can collect. And I'm using parents a lot of time as my sensory system. So a common screening tool that I do when I'm doing motor screening is hand strength. I'm looking for muscle strength, the amount of time a kid can squeeze. Is it equal between two hands? How quickly does the muscle fatigue? There's a whole bunch of testing that I'm doing when I say, hey, squeeze my fingers. Well, I am really evaluating based on the pressure, the amount of pressure, how long that pressure persists and when it fades, and is it equal? So I can say to the mom or dad, okay, so now I want you to have them squeeze your fingers, these two fingers, and squeeze as hard as you can until I say stop. And I don't need to feel it. I can say, okay, so tell me, what did you feel? Was it really strong? Did it feel like it was a loose grip? We walk through and they describe, and I can get assessment data that way. So part of what I love about virtual care is the creativity that comes with trying to figure out how to do these, sophisticated assessments with very little equipment and not in the same room. So that's been a lot of fun for us. We've worked really hard to create those strategies to get the information. And it's only going to get better from here. We are committed to virtual care. Right now, we have an in real life in the office in Allentown, Pennsylvania. And I won't have another site, I don't think. If I do, I might have one or two in real life, and virtually is where we're expanding. So yes, and they need to be born, and I need, a fair amount of time with the parent involved so that we can get good assessment data. We think about humans developmentally, so I don't really have an age in which I can't treat someone. Part of the reason that I did a primary care family practice credential was so that I could treat humans across the lifespan. So we think about it developmentally. Children to age 26, 30, I'm working with. I don't really have an upper limit in that sense. And we have clinicians who are able to treat across the lifespan. So we're really open to humans. I won't profess a deep bench in terms of geriatrics. And I'm working with 3 grandmoms right now, 3 different grandmoms of kids that came into care. So
large variety.
Humans.
Yeah. And that's really great. So if anybody's interested, I did post a link in the chat to go to Every Child, Every Time, the Children's Integrated Center for Success, and people can reach out to you through there.
Sure, absolutely. You can also share my email. I don't think it's on the website. So my email is aedgar@everychildeverytime.com.
Edgar@everychildeverytime.com. Sure about this?
I am, yeah.
All right. Well, that's very kind of you. And let's see here. Kayla asked some good questions that are linking back to what we were talking about a second ago. One of which was about labels and why labels might also at some degree be important. And I think that that's really true. And I'm glad you brought that up, Kayla, because labels, particularly diagnostic labels, are very important for us as clinicians to convey patterns of diagnostic presentations or symptoms. So when we see a symptom pattern, we try our best we can, which is what we were taught, to categorize people into a symptom category that gives us an idea of what might work best to treat this as simply as possible with the least amount of risk. And so that's kind of the diagnostic pathway that we go down. I think when we were talking about labels specifically being detrimental or potentially harmful to the healing process, they are not all disempowering, but they are, they do, when they get attached to identity and you start to think, I am a sick person. I am a person, I have depression, or I am depressed, rather than saying I feel depressed right now, or I am anxious, meaning that the anxiety then gets applied to our past, present, and future, rather than just saying I feel anxious right now, let's figure out what's causing it. Then the way we describe it and attach those terms to our identity can disempower us to recover. Would you say that's similar in your experience? Or I think that's more to add from the autistic ASD perspective.
Yeah, I would agree. And it's such a labels and diagnoses are such a construct of our health system, and such a necessary component to accessing care and support. So especially in the world of children who need resource, families who need resource, and kids who need high levels of support. Diagnoses are required. You can't access, in most scenarios, and if we're talking about commercial insurance and traditional healthcare, you really can't access any of the systems or services without having a diagnosis. So I had the experience of when my daughter was very young, not wanting a label, not caring what we call this. I, want to understand her. I want to rule out any scary medical conditions like muscular dystrophy or, genetic syndromes, rare genetic syndromes. But beyond that, I don't really care what we call it. And I'm concerned about what we call it in terms of how people perceive her. So I remember really struggling that when she was very young. At a certain point, she was doing okay, but really needed more resource. And we didn't have a name, we didn't have a label, and we didn't have a category of services that were assigned to help us. And so at that point, I was almost begging for a diagnosis because it meant we could access resources. And our experience was we went to a developmental pediatrician. They did some evaluations and came back and said, well, she missed an autism diagnosis by 1 point. And I was like, oh God, what does that mean now? Like, what am I supposed to do with that? Like, it's almostism. That's our family joke. Like, oh, it's almostism, right? Like 1 point away. So I think that I really do think that both aspects of that conversation are important, that a diagnosis and a label or a category or a group of people even to be connected to is important. It can be really important. It can also be stigmatizing and disempowering and all the things that we talked about. So out the gate, when I meet families and children, I'm not looking for a label. I'm looking to understand. And I'm very clear about that. Along the way, I'm generating data that can lead to a diagnosis, that can lead to a label. But that's not my priority. My priority is, understanding.
Yep, absolutely. And that's why we're all here, right? So thank you so much for that. There are a couple other.
I'm sorry.
Did you? A couple
I lost sound for a minute. I'm sorry.
Oh, no worries. A couple other quick comments that are coming in, just some clarification for folks. There are more stimulating modes on the Apollo as well, not just relaxing. So we have the relaxing ones are for sleep, deep relaxation, and meditation and mindfulness, which is also doubles for pain and some of the GI stuff that we've been talking about. Then there's the Rebuild and Recover, which is great for post any intense stressful event, physical, mental, emotional, what have you. It helps rapidly calm the body down fairly quickly and restore balance very quickly. And we've shown this in both physical and mental stressful experiences with physical exercise and mental cognitive stress. And then with respect to school and academic performance or focus, it's the ones that are most interesting are the Clear and Focus, which is for deep, intense focus work, Social and Open, which is great for socializing, but also great for creative, clear, focused work. And that is all of the calming frequencies that are considered to be calming. And then there's the Energy and Wake Up, which is like 2 shots of espresso to your face. So unless you suffer from like very serious tiredness in a moment, or you're feeling really fatigued throughout the day, Energy and Wake Up may not be the best one for you, but there are tons of people who like it. For me, I'm too sensitive for it, so I tend to not use it. But I think the number one piece of information that I'll give everyone is to number one is please check out the best use, how to get the most out of your Apollo on the Apollo website. Number 2 in the blog, which is posted here. And number 2, always start with the intensity low and then gently ramp it up. You want it to start out always where you just start to feel it. It doesn't need to be like blasting blasting you off the charts. You wouldn't start your stereo at 100%. You would start it low and then you gradually increase it so you didn't blow your eardrums out. This is the same with our skin. So always start it gentle. It shouldn't be distracting. It should just be, the vibrations of Apollo should just be noticeable.
I would just jump in, David, because I don't know how many people on the call actually know if their child is sensory seeking or sensory avoidant. If they do,
yeah, good call.
Yeah, if they do already know that. So if a child is sensory seeking, and I am a sensory seeker, I like big sensory input, which is why I loved the sub pack kind of full body thing. If you know your child is sensory seeking, don't be afraid to go up in the input, in terms of the input, the intensity of the input, and let them play with it. I think one of the things that's been really fun in working with kids with Apollo is letting them see its impact on themselves. So, crank it all the way. How does that feel? Okay, bring it back down. How does that feel? There's a level of experimentation that's really important. That if you already know your child is sensory sensitive and avoidant or seeking, go with that. So if they're really sensory avoidant and don't like a lot of input, tactile input, then, start very low.
And from our standpoint, we just recommend starting low for everyone, because it turns out more is not more with Apollo. So less. So if you keep it, just turning up the volume or the intensity bar by itself is not going to make the experience better or more effective. The goal is presentness. The goal is to bring us back into our bodies from our minds. It could be traveling anywhere. It could be in the past, could be in the present, could be in the future. So the goal is to use tools like breath. Apollo and breath I would consider very similar. And Apollo is really great for those of us who have not yet learned to breathe deeply or to do breath work. And it can be used as a breath work training tool as well in that capacity. But it reminds us that we're safe and able to sort of, come back down into the present moment. So if at any time you find the vibrations distracting, or your kiddo finds the vibrations distracting, it's definitely too intense. But again, as Amy said, empower your children, right? Empower your children to take control of their health, empower your friends and family to take control of their health, and empower yourself to take control of your health. Because when you do that, especially with kids, they see that as an opportunity to feel in control of their lives. Many of the actions that we see kids do that bother us as adults, that we see kids do that are upsetting, video game addictions, eating disorders, some anxiety and OCD related disorders, hoarding, acting out, defiance, almost all of these things that I've just mentioned, which I don't know anyone who hasn't experienced at least one of them in their lifetimes in someone they know, are typically stem from the child trying to do anything they can to feel in control of their lives. Think about being a kid in the world right now. Put yourself in the shoes of a child in the world right now for a moment and think about how hard it must be to not be able to go out and play with your friends, and to not even be able to go out to a park now in certain states, and to not necessarily even understand why. These kids, our kids, are feeling just like us, but to another level, because they don't have the understanding that we have, more out of control than they might have ever felt in their lives. So giving them something, any tools, Apollo, breath work, stretching and yoga practice, or any of the other things that Amy and I have been talking about here today are I shouldn't say so important, they could not be more important for our children's health at this current and very, overwhelming time for all of us.
Yeah, agreed. I think that the opportunity to connect with your child around something that's positive and is positive for both the parent and the child, in a way that is empowering and supportive, and there's a learning element, and there's a fun element. I mean, that to me is really an incredible resource at this moment in time.
Yeah, without a doubt. And so with that, I'll just check here and see. Oh, actually, there was one last question that came in. Do we have time? I think we have time for one more. This is from Talia. The problem I'm facing with the label, and you actually touched on this, and I think this is.
Oh, actually, can I hop in? I'm sorry. I've been reading the chat. I've been reading the chat too.
Oh, you have?
Yeah. So Kay, and I don't know if Talia said something different, but first of all, I'm so grateful that you guys are here. And what I would say is that I don't presume to speak for an autistic. I don't presume to speak for anyone. And I am in full support of autistics expressing, explaining, and describing the autistic experience. I happen to be the mom of someone who is autistic. And so I have lived experience with her journey in the world. And that's really what I talk about. So I don't believe that there is a kind of global unifying explanation or experience that's called that we can call autism. And I also know that autistic being is a thing. It's a thing. And the more we understand it, and the more people who are autistic explain it, help us understand it, the better it will all be. The better it will all be. So I'm so glad that you're here. And just a shout out for that, Dave. I know this is kind of off topic, but I'm on social media on Twitter a lot, and I actually follow.
Oh, please tell everyone your Twitter so they can follow you, find you.
Oh, so my Twitter is @Prof Amy E, from when I was a professor a long time ago. But really, what I want to say is that I learned so much. I follow the hashtag actually autistic. And I learned so much from just listening, reading, following, interacting with, and appreciate that so much. So thanks for showing up, and thanks for bringing that into this conversation, because you're right. And I think it's really important.
Yeah, without a doubt. And that's also why I think, to Kayla's point, and is talking about focus on listening. As care providers, people come to us to listen to them and to try to help them understand themselves better,
Mhm.
right? We're not telling people what to do. We're not telling people to do things that is, are, risky or crazy, where people come to us in desperation, who are really struggling to figure out, who am I? What am I capable of? Why am I feeling so crappy? And how do I make it better? Or what kinds of things can I do? And we literally, Amy and I, draw from everything we can to help folks navigate these incredibly complex situations. And my cousin, actually, I thought this was a good opportunity. My cousin is Jesse Saperstein, who's written 2 incredible books on autism and living with ASD. One of which I believe the foreword was authored by Temple Grandin. And I just posted my favorite of the 2 in the chat here. Oops, I only posted that to one person. Hold on, let me.
Shout out to Jesse.
Let me share that too. Let me share that with everyone. But yeah, Jesse's incredible. I mean, he's an incredible example of someone who has autism spectrum disorder, and clearly struggles in a lot of domains, but has figured out a way in some parts of his life to be very successful. And for him, it was writing and advocating for other people with ASD and Asperger's. So anything else you want to finish on? I'd love for you to list any other socials that people can get in touch with you with. I think we've basically gotten through all the questions. One other question. Last one.
Okay.
Last one. From Carrie. What is the best way to describe to a kid who's new to Apollo? How do you introduce them to it in a way that makes them motivated to use it? We talked a little bit about this, but someone just asked it again. I'd love to hear from your perspective.
So, so I present to kids, my own and anyone that I work with, that life is an adventure, and that experimentation is the coolest thing ever when it comes to understanding yourself, and experimentation in terms of what you like and what you don't like, and what works and what doesn't work. And so for me, I get 100% yes when I present it as, hey, there's this cool thing that I think that you might like, that could be really cool for you. It's kind of techie. So I have a way of talking to kids. It's kind of techie. It's pretty, pretty amazing, and it's brand new, and not many people have it. And try it. I just want you to try it and tell me what you think. So when I'm talking to kids, I never say like, you have to use this thing and you have to use it in this way and you have to use it until I tell you to stop. I always leave an open-ended conversation about, tell me what you think. I can't wait to hear what you think about it. I can't wait to hear what your experience is. I'm so excited that we had, there's this opportunity or possibility for this to be a cool thing. And then really listen to their feedback. So I think that a lot of times kids get shut down when you present it as like, you have to do this thing, go do this thing. And a second shutdown happens when they say, I don't like it, or I don't like that one, or I really like this one and I want more of it. And they're not heard. There's no response when they give feedback. So right. I think, both kind of approaching it as this cool thing that may help us really figure out, how your brain works in terms of getting excited and calming down. And I don't know, like, I can't wait to hear what you think about it. Right, I can't wait to hear, and
you're creating that like fertile ground for
yes.
in inquiry and curiosity and,
yes.
and nourishing that in the conversation.
Thank you. Yes, that was exactly what I meant.
And I think we're at the end of our time, and I'm going to be extra respectful of your time. I might have lost track of time. We might be 15 minutes over. I apologize for that. But I really want to thank you for taking the time to be here with us. One last question I just realized I forgot to answer is that Apollo only needs a mobile phone to set up the Apollo. You do not need, and to change your mode that you like, or to look at your data. Right now, there's not a lot of data to look at. There will be more coming out. But right now, you only need your phone for setup and changing settings. You don't need a cell phone to use the wearable. So for kids, it works really well because you can set it, or the kids can set it, and then they can take it with them and stop and restart it anytime they want, or adjust the intensity on the wearable itself without the phone anytime they want. Mm-hmm. But that's it for the questions, and I really appreciate everyone sticking with us and joining us. Please feel free to reach out afterwards if you have any questions that come to mind to either Amy or myself. Contact info is in the chat. We'll be following up. This was recorded, so this will be released if anybody wants to watch it again or share it. And Amy, my incredible gratitude to you, because I know how busy you are, and I know how hard you work to just try to do everything you can to improve the lives of kids in your community. And thank you. Thank you.
Well, thank you. And thank you for, your dedication to finding solutions that aren't, that are outside of the pharmaceutical world. So thank you. Thank you for the work that you do. And I can't wait to see what you do next.
Yeah. I can't wait to see what we do together.
Right.
I'm very excited for this work together. So again, thank you everyone for joining us, and we look forward to next time. I think we're going to do this one more time, right? Mm-hmm. Sometime in January, perhaps. Yeah. Mm-hmm. So we hope to see you next time, and feel free to invite your friends if you found this helpful. Thanks again, everyone. Take care and have a wonderful rest of your week.
Good night, everybody.
Holiday season. Bye.